Hello, my name is Madison Colsar, and this presentation is on the strategic plan for Bethesda Hospital East. Let's begin with some background information on the hospital. Bethesda is part of Baptist Health, which specializes in cancer, cardiovascular, orthopedic, women's care, and more. Bethesda is a teaching hospital that partners with FAU's Charles E. Schmidt College of Medicine, and Bethesda is also a nonprofit hospital that is dedicated to the care for all patients in the community. They hold goals to advance the emergency department and social services, as well as implement community health for all. Now for Bethesda's mission, vision, and values. The mission is to improve the health and well-being of individuals while promoting the sanctity and preservation of life. The vision for Bethesda is to provide clinical services that are evidence-based and compassionately provided in order to ensure safety and satisfaction of patients. Bethesda's values align with the values of Baptist Health, which are people, belief, compassion, excellence, and integrity and transparency. Here are 5 goals along with their objectives to further improve Bethesda Hospital East. Goal 1 is to provide necessary assistance in discharge care for all charity patients. The first objective being 95% of charity cases will receive referrals, and the long-term objective being 100% of charity patients receive good care coordination. Goal number 2 is to provide telehealth options for current patient and community members. The short-term objective being 500 community members are informed of telehealth services, and the long-term objective being 20% increase of new patients through telehealth. Goal number 3 is to continue community benefit partnership with Habitat for Humanity to care for patients with housing instability outside of the hospital. The short-term objective is 100% of patients with housing instability get screened, and the long-term objective being 10% decrease in hospital readmissions for housing instability patients. Continuing with the goals and objectives, goal number 4 is to advance cardiovascular and surgical care. The short-term objective is to increase staff training and implement standardized protocols for surgical patients, the long-term objective being 15% decrease in cardiovascular care and surgical complications over 5 years. Goal number 5 is to ensure the promotion of excellence in patient-centered care. The short-term objective being to provide training on communication and cultural competency, and the long-term objective being patient satisfaction rates stay above the national benchmark. Moving on to the markets served and sources of income for Bethesda, the hospital serves the area of southern Palm Beach County, which can include Boynton, Delray, Lantana, and more. Bethesda serves in acute and chronic care patients, including children, adults, seniors, and the underserved. Bethesda's advanced acute care services provide opportunity to give charity care. The primary source of income for Bethesda is the inpatient and outpatient services they provide, which includes cardiovascular, emergency, and orthopedic care, along with cancer treatment and other things like women's care. And in 2024, 90.3% of Bethesda's revenue came from these services, and that information is from Bethesda Hospital Incorporated 2024. Next, we have a SWOT analysis for Bethesda Hospital East. Let's begin with the strengths. The first one being the specialty programs allow for treatment for an extensive number of patients through emergency services, cardiovascular care, cancer care, women's services, etc. Bethesda Hospital East also has a strong health system affiliation with Baptist Health, which gives the hospital a good reputation and allows for coordinated care and shared resources. Community-focused mission allows treatment of the underserved, and the hospital is a teaching hospital, which shows strength in planning for the future. The collaboration with FAU helps recruit and develop future healthcare professionals. Moving on to weaknesses. Facing a competitive market, which community has access to, including Delray Medical Center, HCA Florida, JFK Hospital, and more that offers similar services. Bethesda has a high emergency department demand, resulting in high patient volumes that create overcrowding and long wait times. Bethesda heavily relies on reimbursement due to being nonprofit, and Bethesda's diverse population can increase the demand for health services. Moving on to opportunities, the population growth in Palm Beach County will create an increased need for many services that Bethesda Hospital East offers. There's an opportunity to extend community outreach, which can be done through community education, preventative health and programs, and more. There's an opportunity for Bethesda to build on the brand of Baptist Health, which can help strengthen the community and establish trust and attract additional patients and support. The hospital's investment in technology and innovation will give an opportunity to strengthen its competitive position. Finally, we have the threats. This competition for nearby healthcare systems that offer similar services is a threat. Government regulations and reimbursement changes are also a threat to Bethesda. Medicare, Medicaid, and other purchasing programs can make changes that reduce reimbursements for the hospital, as well as raising compliance costs. Increasing charity care can cause a rise in bad debt, which can put a lot of pressure on the hospital. And finally, constant advancement of technology can become challenging in education and pricing. Next, we will go over the action plan for Bethesda Health, and we will start with the goal. The goal involves improving access to charity care, streamlining financial assistance processes, expanding community outreach, and ensuring compliance with regulatory requirements. This will help fine-tune Bethesda's charity care and make it more accessible and financially possible. We will start with year 1 of the action plan, the first objective being increase awareness of the charity program by 30%. Some action steps are create educational materials, give information during admission and discharge, and promote program with social media. The people responsible would be the Director of Financial Services and the Marketing Manager. The resources needed would be marketing staff, registration staff, financial counselors, and community organizations. The cost would be $20,000. The objective number 2 would be to reduce application process time for financial assistance to 10 days. The action steps would be train registration and financial staff, standardize screening procedures, and begin application tracking. The people responsible is the IT manager and the financial counseling supervisor. The resources needed would be IT support, EHR systems, and training staff, which is $35,000. Objective number 3 would be improve knowledge of charity care with policies within the staff. The action steps would be have mandatory education sessions, make policy guides, educate staff with annual assessments. The people responsible would be human resource manager and risk manager. And the resources needed would be the education department training materials and education resources, which would be $10,000. Moving on to year 2 of the action plan, the first objective is to increase approved charity care applications by 20%. The action steps are to partner with local nonprofit organizations and aid with uninsured patient applications. The people responsible will be the Patient Financial Services Director. The resources needed would be financial counselors, community clinics, and nonprofit organizations, and the cost would be $30,000. Objective number 2 is 95% or higher of compliance with financial assistance policy. The action steps would be quarterly audits, monitor documentation, and provide corrective education if needed. The people responsible is the compliance officer and the quality improvement manager. The resources needed would be compliance team, quality staff, and compliance consultant. And the cost would be $20,000. Objective number 3 is to strengthen community partnerships and improve access to financial assistance services. The action steps are referral agreements, collaborate with local organizations, and attend community health fairs. People responsible are community outreach coordinator and social work manager. The resources needed would be outreach staff, social workers, community partners, local government agencies, and the cost would be $25,000. Finally, we have the year 3 aspect of the action plan. The first objective is to use financial screening to reduce uncompensated bad debt by 15%. The action steps are identify eligible patients before discharge, expand bedside financial counseling services. The people responsible are the CFO, Revenue Cycle Director, and Case Management Director. The resources needed are financial counselors, case managers, and IT staff, and the cost is $50,000. Objective number 2 is improve patient satisfaction with financial assistance services by 15%. The action steps are to conduct patient satisfaction services, improve communication, and address patient feedback. The people responsible are Patient Experience Director and Financial Services Manager. The resources needed are survey tools, patient relations staff, and survey vendor, and the cost is $15,000. Finally, the third objective for year 3 is evaluate program outcomes and create a new 3-year plan. The action steps would be to analyze KPIs, compare outcomes to benchmarks, and develop new strategic goals. The people responsible are the COO, the CFO, and the Director of Patient Financial Services. The resources needed are a leadership team, financial department, and quality improvement staff, and the cost would be $20,000. This concludes the action plan and strategic plan for Bethesda Hospital East. Here is a list of the references that were used. Thank you so much.